Good evening, everyone. Welcome to the Black and Minority Ethnics in Psychiatry and Psychology Networks in conversation with Black professors in mental health online event. This event aims to acknowledge and celebrate the incredible contributions of Professor Dawn Edge and Professor Stephani Hatch to the mental health field. Primarily and specifically, we highlight and discuss the professorship journeys of these two incredible individuals and highlight and discuss their work. But most importantly, this event will inspire and encourage Black students and professionals in psychology and the behavioural sciences into the academic field. My name is Keisha York, and I am the founder and managing director of the Black and Minority Ethnics in Psychiatry and Psychology Network, or more shortly known as the BiPP Network. And I will be the chair for tonight's events. At this moment, I'd also like to take the opportunity to introduce some of the directors of the BiPP Network, who will also be supporting us with this event. So first, just to say a quick hi, I'll introduce Jason.
Yes, on the microphone.
Jason, do you want to say a quick hi? Unmute your mic.
Hear me now? Sorry. Hi everyone, thanks for being here. Really glad that you could make it. Welcome to our event. Hearing lots.
Jason, use the built-in microphone. It'll be a bit louder.
Can you hear me now? Sorry. Hi, everyone. Welcome to the event. Thanks for coming. We got there in the end.
Jason, thank you for introducing yourself. Can we next introduce Jessica?
Hi everyone, I'm Jessica, I'm a medical student and thank you all for coming today.
Deji?
Hi everybody, I'm Deji Maxwell. I'm a mental health advisor. Thank you for coming to the event today. I'm one of the managing directors on the BiPP team.
Wonderful. Grace?
Hi everyone, I'm Grace. I am also on the BiPP team and I'm working in strategy and innovation with Jason.
And last but not least, Idris.
Hi, my name is Idris, and I work in the event and promotion and logistic part. And yes, I'm glad that I'm here tonight, and I welcome everybody. Thank you.
So I just want to go through some ground rules for tonight's events. The first one is to ensure that your mic is always muted throughout this event. The second one is you can send any questions or any comments you may have via the chat function to our BiPP in-session support. These are the individuals that have just introduced themselves. So I just want to go through a polite trigger warning, which is that the event will discuss racism and social inequalities, which may be distressing to some viewers. And this event will be recorded, and by participating, you agree to being recorded in this event. If you do have any concerns or queries, please direct them to the team@bippnetwork.org.uk email address, and someone will be able to get back in touch with you very shortly. We will have live tweeting throughout this event, so please ensure to tweet us at Black Professors in Mental Health. That's the first hashtag, and the second hashtag is at the BiPP Network. You can follow us at the BiPP Network on Twitter, Instagram, and LinkedIn. Also, very briefly, I'm just going to go through the event schedule for tonight's events. For the first half of this event, we will have a 90-minute Q&A session with the chair, myself, and the speakers. We'll have a 5-minute break and then a 45-minute unstructured Q&A, which will be between yourselves as the attendees and the speakers. Yet again, you can submit your questions via the chat function. So without further ado, I'm going to introduce our esteemed guests for tonight's session. First and foremost, we have Professor Dawn Edge. Professor Dawn Edge is a professor of mental health and inclusivity in the Faculty of Biology, Medicine and Health at the University of Manchester. Currently, she's the only Black woman at the institution and as a professor. And she's also the university's academic lead for equality, diversity and inclusion with a specific remit on matters related to race for students. In a healthcare system founded on the principles of equity, she regards health disparities as a social justice issue. Her research to improve mental healthcare is driven by passion and desire to eradicate the evident injustice of disparities in access, care, and outcomes experienced by people from the African, Black, Caribbean diaspora, and other underserved communities. The meaningful collaborations with service users and their families is at the heart of her work. This involves partnering with community members throughout the research process, from identifying questions through research design and implementation to evaluation and dissemination. She currently leads a team that is co-creating and evaluating culturally adapted family interventions with sub-Saharan African and Caribbean descended people in the UK who have been diagnosed with schizophrenia and related psychoses, and their families. The study is taking place in the Northwest Midlands, London and the south of the country. She has written a number of academic papers and presented her work internationally, including South Africa, the United States of America, Canada, Jamaica, and Barbados. And she recently co-authored a chapter in the first ever handbook of Black community mental health. Outside of her work, Dawn is an active member of her church. Her faith underpins her values about serving her community and desire to make a difference in the world. She enjoys her time with her family and friends, reading and gardening. Dawn, would you like to say a quick hi to our attendees tonight?
Hello everyone, it's a pleasure to be here. Thank you, Keisha, for inviting me and for that lovely introduction.
Thank you very much, Dawn, for being here. We're very excited to speak to you tonight. And next we have Professor Stephani Hatch. So Stephani leads the Health Inequalities Research Group at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Her research is focused on discrimination and other forms of social adversity, community mental health, inequalities in mental health and health services. She is currently the principal investigator for the Tackling Inequalities and Discrimination Experiences in Health Services, TIDES, study, funded by the ESRC and Wellcome Trust, and leads the HYPE Improving the Health of Young People project. Stephani is also a co-investigator for the ESRC-funded Centre for Society and Mental Health, leading a programme focused on communities and mental health. Stephani was co-PI for the South East London Community Health Study, a psychiatric and physical morbidity study set in the London boroughs of Southwark and Lambeth that began in 2008. Finally, Stephani is the founder and lead for the Health Inequalities Research Network, HERON, a public engagement network that promotes collaborative community approaches to acknowledge dissemination, action, and youth outreach. She's also been co-leading initiatives promoting and changing policies to ensure embeddedness of diversity and inclusion at King's College London since 2014. She also serves on the national advisory boards in this area. She is currently the co-chair of the IOPPN Diversity and Inclusion Self-Assessment Team. So with that, I'd like to welcome Stephani, and I want her to say a quick hello to our attendees.
Hi, everyone. Thank you so much for having me, and I am honored to be in the company of Dawn Edge.
Thank you, Stephani, for being here. We're very excited as well to speak to you about these topics. So before I unshare my screen, I just want to remind you to follow us on Twitter and make sure to tweet us under the hashtag Black Professors in Mental Health and also the BiPP Network. Right. So with no further ado, we're going to start our first topic for tonight, which is all about education and training. So the road to becoming a professor has been described as long, tough, and filled with disillusion. Particularly, a study by the Royal Society found that only 3.5% of students that complete a PhD secure a permanent research position at the university. Of those lucky few, only 12%, or 0.45% of the total, make it to the professor level. So with that, and just to start this event, can you both tell us your path to professorship with particular reference to some of the qualifications and roles you obtained throughout your journey? And I think I'll begin with Dawn.
All right, so my word, where do we start with that one? This is a very interesting conversation. So I think I should start with a disclaimer that my route is not very typical. So although I'm a professor of mental health, my actual clinical background is in physiotherapy. I was a physiotherapist, and I became enraged, is the best way I can think of describing it, when I was asked to join the board of trustees of a third sector organisation called African and Caribbean Mental Health Services in Manchester, which had been set up back in the 80s in response to the clear inequalities in the care experienced by Black service users, patients. And so I was asked to join that kind of maybe at the end of the 90s, perhaps, and just hearing people's stories of what they'd encountered in services and realising that little had changed, and sadly, I don't think much has changed even since then. And then I was invited to, or I wasn't invited, I secured a position as a non-executive director at a mental health trust because I really wanted to get an inside track about what was going on. And I, again, was just I knew about the overrepresentation of Black people in secure services and in the coercive end of psychiatric care, but actually going on to a ward and seeing it was a whole other thing, and listening to people's stories was another thing. And so with that, I was obviously doing a lot of reading, trying to understand systems and looking at the research. And what struck me was the stuff that I was reading. You know, there was a lot of research about in terms of the epidemiology, telling us about the numbers of Black people in services. What I couldn't see or any reasonable explanations for why that might be. There are some theories. But what I definitely couldn't see was any kind of alternative to medication. I couldn't see any work being done that would offer people an alternative, which is not to say that it's not there, but certainly at that stage I couldn't see it. And so that began my journey into away from, I was already an academic, a clinical academic in another university. And that's really when I started to think about what I was going to do for a PhD, and that kind of started me on that journey. But interestingly, it wasn't kind of those people in the coercive end of psychiatry that I chose to focus on, because in a way there was a lot that we knew, although we still don't understand as much as we perhaps ought, about Black men. So there was a lot of association between Black men and mental illness, and particularly psychosis and schizophrenia. And I was really intrigued by why there was so little work about Black women, Black women's mental health. And in particular, so at the time when I started my PhD, there was a lot of interest in the media. There were social, even on TV, there were soap operas that were featuring postnatal depression. It was quite a hot topic. And I didn't know any Black women that talked about having postnatal depression. Not anybody. So that really was the start of my PhD. So, doing a piece of work that where I screened Black and white women for depressive symptoms and risk factors and that kind of thing, and then talked to Black women about their views, experiences, attitudes to help seeking. So that started. That's the PhD. Then postdoc, because during my PhD, I went to a range of different mother and baby units in different places, and nearly always the response was, "Oh, we don't see Black women here." So my postdoc work was actually talking to healthcare professionals about what that meant and why that might be. So why were Black women invisible in their services? And And then subsequently, take a bit of a leap forward, because in the interim, there was a bit of what I call my wilderness years. So I'd moved to Manchester. I had a faculty fellowship for so-called Rising Stars. And yeah, I came to the end of that, and there wasn't really anywhere for me to go. It wasn't, you know, and so I do understand those people who kind of drop out of the system, because I was on the verge of doing that, very nearly. But the work that I'd been doing in the community conferences and talking to people about what needed to be done, and then out of that, people's conversations and what they wanted, and they wanted talking treatments, and they wanted advice and information, and out of that kind of came the studies that became funded, and then I subsequently had a lectureship, and then senior lectureship, and then my chair. But you're absolutely right, it is quite a journey, and maybe we can pick up some of the other things. I want to give Stephanie a chance to speak, but some of those challenges along the way when you want to do work which is regarded as being quite niche, when you want to talk to people, which means if you're going to publish your work, it's going to be predominantly in qualitative journals, which don't even feature on the hierarchy of evidence. So in terms of your work being seen as being high value, that there is a bit of a dissonance there. So you want to do that work, you want to make a difference, but actually it is risky. It's a risky strategy. So I'll pause there.
Thank you. Well, that's such an interesting journey, and it's actually very interesting that you picked up on how there's just this lack of exploration on Black women's mental health, and definitely interested to pick up on your point and your PhD around postnatal depression, and also why you kind of ended up on the verge of dropping out, but we'll pick that up later. So Stephanie as well, will be interested to hear yet again your professorship journey, with particular reference to the qualifications and some of the roles you obtained throughout it.
So I think my journey started when I was an undergrad. So that was when I had my first experience doing research. And I was really fortunate, despite being at a large university in the Midwest, studying psychology and experiencing quite overt racism, probably from the time I landed on campus. I was able to join a research group where I was line managed by a Black female PhD student. And that was really my first time thinking, all right, night one, I really enjoyed research. There was something about it that I felt really resonated with me. And the first research project was focused on the experiences of men in terms of domestic violence, being the victims of domestic violence. So it was also about thinking about topics that didn't, where we had gaps in our knowledge. And these weren't this wasn't the population that people attended to in terms of psychology. And there was a lot of shame and stigma that these men felt. So Black men and white men in this area of the country where, it certainly was not. I sort of liken the Midwest to the north of England. So if you can imagine the pressures that men were on, that men had. So that was one. And then there was one Black female professor in psychology in the psychology department. And the PhD student that I was working for encouraged me to go along and speak to her. And I eventually developed a relationship with her, and she talked a lot about what it was like to be an academic, and she was just a brilliant mentor to me, and really helped me think about what my next steps were going to be after undergrad. And so I applied to do a master's in sociology, because in the US system you have a major and a minor. So I was majoring in psychology and minoring in sociology, because I was very interested in the sort of social context, and very interested in social problems and how they contributed to mental health problems. And so it seemed like a natural progression, because I'd been studying social psychology in the psychology department. So I went and started my master's, and that was, again, in sociology of mental health. So in the US, that's very much a focus within sociology, and adopting quantitative and qualitative methods to answer questions in relationship to social inequalities. And I was really fortunate that I got a research job. So I worked all the way through my, I worked through my master's degree for Professor Claire Stirk, who was epidemiologist, but she was also a medical anthropologist. And we were looking at the role of women in the drug use economy. So it was predominantly Black women who were using crack cocaine and were also dealing with, a variety of mental health issues, mostly undiagnosed, but also were HIV positive. So we focused a lot of the work around mental health and HIV in communities. And this is in the 90s, early 90s. And I spent a lot of my time, really focusing on the needs of the communities. And that's what Claire really taught me, was around the idea about reciprocity in research, that you don't just go and take information from people, that you think about what we could give back. So what are those resources that we may have that we could use to improve the lives of the community? So I worked in various research jobs, and the more I worked, so in the communities and drug treatment services, and in prisons, in both maximum and minimum security prisons, and work focusing on mental health and HIV, I started to think the only way I'm going to be able to do what I want to do and do the types of research that I want to do is if I get a PhD. It wasn't something I'd planned, all the way through or wanted to be an academic from a young age. It was really about what I needed to get to the next level. So went on to do a PhD in sociology of mental health. And again, it's a very different system in that it's a much longer process in the US because you sit at least 2 years of coursework, you've got comprehensive exams, there's a whole process before you even start your research. So after completing that, I did a postdoc training fellowship in psychiatric epidemiology at Columbia University. And I want to take a step back because it's something really important happened when I was doing my PhD. I came into the program as a teaching assistant and therefore had my fees and everything paid for. But I was encouraged by my mentor to apply for a national fellowship that was being provided by the National Institute of Mental Health in collaboration with the American Sociological Association. And I never would have applied for that. I didn't think that was for me. I didn't think that, they chose maybe 5 or 6 people nationally across the US every year. But he pushed me, and I worked up the courage and applied for it, and I got it, and it was a game changer. And I, to this day, remember the day that letter came in the mail, because I look back on it now, and it was the point that set me on a completely different course. And so when I finished the PhD, going on to do the postdoc fellowship, again, that was a national training fellowship. It took me into psychiatric epidemiology, which isn't a big leap in terms of American sociology. So it was really allowed me to start to think about having more training in terms of the clinical aspects of what I was doing. And then I came to the UK as a postdoc, finished that postdoc fellowship, which was 3 years, and came to the UK. Have been here since 2005, first at UCL as a fellow working with an MRC group, and then joined King's in December of 2006. And I've basically spent my entire academic career here. Yeah, and I was very fortunate. I will say my path to becoming a professor has very much been about the support and mentoring that I've had over the years. And I can talk a little bit about more of that later.
Thank you very much, Stephanie. Both of your journeys are fascinating. Particularly, I like how you spoke about the importance of having someone who was a Black supervisor and a mentor, and how that person really encouraged and pushed you into applying for your scholarship and pursuing academia, and also how your own research interests helped you acknowledge that a PhD was really necessary. And we're actually going to pick up on that later about the importance of role models. But actually what both you and Dawn pick up on is some of the barriers that some people within academia who are of a Black ethnic background that can face. Specifically, Stephani, you talk about the overt racism that you experienced on campus while you were doing your psychology studies. And Dawn, you also discuss this idea of, you noticed very quickly that there was no representation of Black women, particularly in your services. So I guess my next question would be, what barriers, if any, did you face throughout your professorship journey? And how did you overcome these barriers? And I think I'll start with Stephani, just kind of going off from what you've just said, and then we'll move to Dawn.
So I'm going to go even further back in time because I think it's really important. When I was in high school, despite being a strong student, my guidance counselor discouraged me and other Black students from getting the necessary diploma to apply to university. And it was because my parents placed such a high emphasis on education that wasn't happening. And they actually spoke out on the behalf of other Black students as well. So fortunately, they intervened at that point and were persistent about it. And at a later point took me out of that school. And I finished high school at another school, at a performing arts school, because it was just, they could see that it was sort of a theme throughout, where I was being funneled to go as opposed to what I was capable of doing. So then going to university, again, telling me, you shouldn't apply to a 4-year university, you should apply to community colleges, which isn't in the US, or, that's not going to get you on the path that I ended up on. I think those were, they are barriers for a lot of young Black people in terms of how you're discouraged even before you get to university. So then you arrive at university and you are looking around and there is not really anyone who looks like you. I mean, it was a bit of a challenge, and I would be, it was a large university of about 40,000 students. And I would be in I remember distinctly being in a chemistry lecture with probably about 300 students. So these massive, great lectures, and the professor pointing to me and the other Black students and saying, attendance is mandatory, and I'll know if you're not here. So it's just that kind of message over and over and over again that, you've got to work in a different way and have a different level of focus if you're going to get through this. I think, I think it's the barriers keep coming. I arrived at King's, and I'm very open about the fact that I was, having gone to, so I did my PhD at University of Maryland. And just to give you a sense of what it was like there, I had 5 or 6 other Black female PhD students with me in my cohort or the years around me, and we had support for each other. I had Black female professors that guided us and really talked to us about racism within academia and mentored us. The year I finished my PhD, 4 Black women completed a PhD in mathematics at my university. So it was, it's not to say that it's a rosy picture, because if you look at the stats now in the US, only 4%, even with everything in place in the US, much more so than here in terms of addressing those barriers are Black. So it's not to say that, but I had developed this kind of rosy picture. So then going on to Columbia, there were very few Black people, but I had 2 other Black female postdocs who were within my group. I, came to King's, and it was, yeah, there was no one that looked like me, and I really started to feel that being in this environment would be a barrier to me achieving my goals. And as I've said to other audiences, I think one of the things that I had to make a decision about was to take control. And for me, that meant having conversations with my line manager as a lecturer, you know, saying, we have to be able to talk about race or else this isn't going to work. And he was very open to that. And we continued to have those conversations, even though sometimes I'm sure they were very uncomfortable, particularly for him. But we got, you know, and they continued to be, you know, very important over the years. So he's been incredibly helpful, I would say.
No, thank you, Stephanie. I will say, even myself being at King's, they very much have a lot of race discussions. We have the race equality working groups, and I'm sure that probably stemmed from your push to drive the conversations around race. So what the work you've done has clearly led to an outcome that we can start to see. And I'd just like to take from Dawn as well. What barriers did you experience? Was it something along the lines of the isolating experience, or the overt or covert racism, or so forth?
So I have to say, I'm sitting listening to Stephanie, I am so jealous. You know, to have amazing mentors and other people around you who look like you, that you can talk about what you're experiencing to people understand, because I didn't have that. So as I said, my first career was as a physiotherapist, which is a little bit more diverse now, but certainly not when I did it. And so I remember when I was doing work experience at school, and I wanted to apply that, I did a work experience at a hospital, and we'll call the superintendent, the head physiotherapist, called me to her office and just said, you know, this is not a profession for people like you. So it did make me smile many years later when I became a lecturer in the university that was affiliated to that hospital, and I was by then in charge of the clinical education component, which was the bit that actually conferred people's ability to practice, and was, you know, kind of a third of the award, and I was on the National Council and doing lots of other things. I just thought, I wonder what she'd say now. She could see me now. And in a similar kind of way, when I got to the point of thinking about what to do for a PhD, because I was by then in academia, although, you know, kind of very much as a clinician, a clinical practitioner. And I knew I wanted to do something that was going to make a difference. I knew I didn't want a PhD that I was going to sit on the shelf. So a bit like Stephanie, I didn't set out to have an academic career. I loved being a physio, absolutely loved it. Miss it to this day on lots of levels. So that was not my direction. What got me into academia, strangely enough, was because I used to have students on placements and junior staff, because I used to head up a stroke unit at this point, or the physiotherapy on a stroke unit, and the students were so badly prepared for being on placement. And so I went to the school and just said, look, to the physiotherapy school, and said, look, I have these students for 6 weeks. I spend 2 weeks unteaching them stuff that they've been taught badly, and then 2 weeks teaching them what I need them to know. And so that gives us 2 weeks for them to actually achieve very much. So why don't I just come and teach them what I want them to know? And they went, yeah, okay. So that was my foray into academia, and that there are lots of other things but that was my toe in the water, as it were. But that wasn't anything different. That was just an extension of my day job, as it were, really. But then move into doing stuff around mental health, and very much at the social science end of mental health, because I was interested in people's stories and their experiences. There's enough stuff done about the epidemiology, not that that's not really important, because it is, and we need to understand that, but very often the voices of people who are marginalized are just not heard, and that's what I wanted to do. That's what I wanted to understand from people. So yes, but certainly when I think I mentioned very differently to Stephanie, going transitioning to the university that I'm at now and getting this internal fellowship, and with that came a mentor. And I remember going to see the person. So after I'd been awarded, I remember going to see a senior academic. So I was invited to go and see this person who'd been on the panel. And we were encouraged to go and see the people on the panel to actually get some feedback about our performance and so forth. And the very first thing this man said to me is, "You're very ambitious, aren't you?" And I thought, I've just been awarded a faculty fellowship. I think, I don't know, there were maybe 100, and I don't know how many people applied, and I think there were 3 that were awarded. How can you get one of these things without being ambitious? And then when my line manager went to see her, and she said exactly the same thing. And I remember coming home and writing in my journal, why is it that when they use the word ambitious, it sounds like a dirty word? What is that about? So that was a bit of a, you know, rather than people going, hooray, you've got a fellowship and it's fantastic and we're going to do all this work to support you, it was, oh, you're very ambitious. Get my head around that. So yeah, so in some ways, looking back, it wasn't surprising that by the time I arrived towards the end of that fellowship, so the idea was that it was supposed to enable you to move towards becoming an independent researcher. But I actually got, but really, you wouldn't be surprised to hear, very little support along during that time. And one of the things that happened with the fellowships is that annually you had to go and present your research, and then you'd meet with senior academics from outside of your discipline at the university, and they would ask you questions, and you know, you could talk to them about your journey and so on. And I remember on this particular occasion, one of the panelists said to me, "You're doing an awful lot of work. I can see that you're writing fellowships, you've done a lot of work, but these fellowships are not being successful. Who is working with you on that? Who is explaining to you, looking these over and telling you why they're not being successful?" And you know, it was all I could do not to cry, because I sat there and I just thought, no one. I'm doing this. Yeah, this is me. I'm doing it. So, and then, but the thing that saved me, and I actually went and told this gentleman this a couple of years ago when I got my senior lecturership a few years ago, because he said, "Do you know, I know this is really, I can see that you're really upset." I didn't cry, by the way, but I felt like it. He said, "I can see that, and I know it must be really demoralizing." He said, "I'm just going to tell you that the work that you do and the work that you want to do has the potential for making a far greater impact than many of the other people on this fellowship thing. We'd all gone and had a bit of a showcase where to talk about our research, and people were doing stuff in cancer and all kinds of fancy things, and I was talking to sad black women." And so that I kind of kept that in my head. So that may be along the journey one of those few moments when someone said something that made me think, I'm going to hang on in there. I'm going to hang on in there. But it wasn't, unlike Stephanie, there weren't people around. But I did at one point, when I think, as mentioned before, thinking about I'm going to just give this up. It's just too, I don't see where it's going to go. I'm not getting any fellowships and so on. But then I made the decision that I was going to ask people. So in fact, I chose 4 people whose opinions I valued, all 3 white women and an Asian man, all professors. And I sent them my CV, and I said, I want some advice. I want to come and talk to you. And I basically went and said to them, do you think I've got what it takes? And they said yes. One of them said, the Asian guy said, you need to leave. You need to go somewhere else where what you've got is valued, because with a CV like this in other places, you would be getting promotion, not be looking at being made redundant potentially because you haven't brought in any income. So yeah.
Thank you very much, Dawn, for that very emotional description. Well, for me, it was very emotional to hear that, both you and Stephanie's journey, because I think what you both describe is the experience of being a Black woman and having to face various tribulations, but still at the same time work harder than all your peers, have a lot of resilience to address these various barriers, and yet still find a way to publish your research and become a professor, which you both are. And I think this quite nicely leads into our next topic about some of the research and publications that you have both done, and in light of your experience and also your interest. So I guess my next question is largely based on some research which shows that the effectiveness of mental health services in the UK have shown that profound inequalities exist for ethnic minority groups in their ability to access treatment, receive appropriate care, and reach equal mental health outcomes. For example, the independent review of the Mental Health Act found that Black and African Caribbean people were more likely to be diagnosed with schizophrenia and 40% more likely to be detained under the Mental Health Act, and less likely to be referred to mental health services from GPs or talking therapies. So these hampering statistics demonstrate the importance of both of your work, which explores the impact of ethnicity, deprivation, discrimination, socioeconomic status, migration status, minority status, and so forth on mental health. So my first question would be, and I'm going to direct this towards you, Stephani. What does your research tell us about the impact of these factors on Black people's mental health? And how might these sectors impact access to healthcare and treatment for Black people?
So I think the first thing I'll say is there is you've read out this narrative around Black people's mental health, and it skips out the area that I mostly focus on, which is around common mental disorders. So, leading the Southeast London Community Health Study, we looked at a range of mental health issues among people in the population, but I mostly focused on experiences of depression and anxiety, because one of the things that I've noticed is we don't get to be depressed and we don't get to be anxious, right? So it's really around the issues regarding prevention. Like there's very little prevention in the community. So what we found in Selco was that there were high levels of need in terms of mental health in the community, but very small proportion of people who were in contact with services. It was really important to me that we focus on the social context and focus on the social experiences that people were having, and that we made sure in the process of doing this, it goes back to what I was saying about that reciprocity. It was about what we were giving back to the communities. One of the things that I'm not only going to talk about what the research tells us, I'm going to talk about the process, because it's really important that the message gets across. And I think Dawn is saying the same thing, that you don't do this research without serving communities and working with communities in ways that allows them to have their voices heard. So I sat with colleagues and I decided that I wanted something very similar to my earlier experiences doing research, where it was focused on not only reciprocity, but sustainability, so that we're never going to be the group that just sort of helicopters into a community or school or what have you, gets what we need and leaves. That there's a whole piece of work that has to be done around understanding what the community needs, what their priorities are, building trust, maintaining that trust over periods of time, sharing the information that we're gathering, and showing respect for the knowledge and the leadership within those communities. So with Selco, that was really a strong part of it. My team didn't just go and knock on doors and go in households and take. It was about spending time in those communities, understanding those communities, and then relaying back any information we thought that would help, working with community organizations through Heron to try and do things in a different way. Because when we started this work, it was not a positive thing that we came from the IOP. And certainly, at one point I even had to tell them to remove those IDs and where just their, because at the time we had two different IDs for King's and for the IOP. So it was about rebuilding trust in the community, and predominantly in the Black community. And so that was really important, and talking to people about various issues that they had not been asked about. So again, it was a narrative around severe mental illness without thinking about what the mental health continuum looked like in the community, and the things that the adversity that they had been experiencing right over the life course. So when we're focusing on racism and discrimination, we're talking about something that for many of us, we experienced, you know, at a very young age. I mean, I grew up in the South in the United States, and my first memories of, you know, witnessing discrimination and experiencing it are a very young age, you know, even probably before it's one of my earliest memories. So I try to emphasize, you know, there was a real lack of focus around racism and discrimination in relationship to mental health in comparison to other places that I'd been in the world. So that was really something that I felt needed to be brought to bear and talked about in terms of its complexities. So it not just being about your experiences of discrimination, but also what you witness, what you know, anticipating discrimination. So by that, I mean avoiding certain situations or certain areas because you think you're going to be treated differently. And that includes health services. So looking at, you know, what is the process of, you know, these people focusing on barriers to health services. But I started thinking, wait, let's turn this around. Why would you go to health services? You know, how are people treated? So it's really about that movement. And again, that's why earlier in my career, I was so interested in going into different contexts, into the community, into services, prisons, et cetera, so that you can understand, you know, all of what Black people are experiencing, a lot of Black people within families, within, you know, communities. That are affected by a lot of these issues. So that was a really influential piece of work that I did in my career, and certainly the TIDE study follows on from that because it's very much focusing on, you know, a tractable problem, which is discrimination within health services.